We know that no matter how common it may be, bladder control problems are still embarrassing and hard to live with. They can interfere with work, social activities, and your romantic life. What's most important to know is that urinary incontinence can be cured, treated, or at least better managed. What you don't want to do is ignore this problem, as it rarely goes away on its own and may even get worse over time. Instead, educate yourself about why you may be experiencing bladder leaks and how it's connected to your menopause symptoms. Menopause in women marks a sharp drop in estrogen, the main female reproductive hormone. Estrogen is important for keeping the ligaments of your pelvic floor strong and elastic. When the levels of this hormone drop, the ligaments that hold your bladder in place become thinner, weaker, and less resilient. In men with enlarged prostate, your bladder has to work harder to squeeze the urine out. This makes its walls thicker and weaker. That makes it hard for your bladder to empty all the urine in it. One of the changes many women and men notice is increased difficulty with bladder control. There are two types of bladder leakage that can happen after the menopause. The first is known as stress incontinence and happens when the ligaments and muscles of your pelvic floor become stretched. When you cough, sneeze, or laugh, pressure is applied to your bladder. If the ligaments and your muscles supporting it are weak, then urine escapes. Overactive bladder. This occurs when a muscle in the bladder contracts more often than normal. This causes a person to feel a sudden and sometimes overwhelming urge to urinate even when the bladder isn't full. This type of sensation happens more than 8 times over 24 hours, often including 2 or more times a night. Urinating frequently and rushing to the toilet to pass urine are the most common symptoms. Other common signs include leakage of urine with coughing, sneezing, or exercising, leakage of urine on the way to the toilet, waking up more than twice at night to urinate, frequent urinary tract infections, and constipation. The causes and the type of incontinence are closely linked. Pregnancy and childbirth. Menopause, as falling estrogen can make the muscles weaker. Age. Obesity. Medications. Alcohol. Urinary tract infections. 10 ways to prevent and manage poor bladder control. Number 1. Do daily pelvic floor exercises, also known as Kegel exercise. If you want to strengthen your pelvic floor to relieve symptoms, replace high-impact exercise with stretching and strengthening core muscles. High-impact exercise puts pressure on your pelvic floor muscles and can increase leakage. Number 2, bladder training. Learn how to delay urination whenever there's an urge. The aim is to control urge. Number 3, avoid lifting. Lifting puts strain on your pelvic floor muscles, so when you need to lift something like picking up children or shopping bags, tighten your pelvic floor muscles before and during the lift. Number 4, losing weight. Being overweight can weaken your pelvic floor muscles and can cause incontinence because of the pressure of fatty tissue on the bladder. Number 5, cut down on caffeine. Caffeine can contribute to bladder irritation and stimulate muscle contractions, which can both cause incontinence. Caffeine is known to excite the brain, and since the control of the bladder is in the frontal lobe of our brains, it has an excitatory effect on the bladder as well. Carbonated drinks, coffee, tea, energy drinks, and chocolate also contain caffeine, so cut down on these two and replace them with water or switch to decaffeinated. Number 6, cut down on alcohol. Alcohol is a diuretic which makes you urinate more often. Cutting down may help your incontinence symptoms. Number 7, quit smoking. If you smoke, you put yourself at risk of incontinence because coughing puts strain on your pelvic floor muscles. Number 8, surgery. Surgery is an option if other therapies do not work. Women who plan to have children should discuss surgical options with a doctor before making the decision. Number 9, absorbent pads. A wide range of absorbent pads is available to purchase at pharmacies and supermarkets as well as online. Number 10, eat the right foods. Avoid spicy and acidic foods as they can irritate the bladder and make leaks and other incontinence symptoms worse. Magnesium, an important mineral for proper muscle and nerve function, could relieve incontinence because it reduces bladder muscle spasms and allows the bladder to empty completely. Include magnesium-rich foods such as corn, potatoes, and bananas in your diet. Stay hydrated. It sounds counterintuitive if you always have to go, but drinking enough water is crucial in managing incontinence. If you don't stay hydrated, you may end up constipated, which can irritate the bladder further. Do not let urinary incontinence control your life. Do not let it keep you at home or affect your typical activities. All it takes is a little planning. Most importantly, talk to your doctor and those close to you. You may be embarrassed at first, but they can help you work on solutions. It is important to know that you aren't alone in this. Well, I hope this helps in coping with incontinence, and if you like this video, please subscribe and give me a thumbs up.